And in the meantime, at the table, we have Katinka de Korte, entrepreneur from Dear Health. Welcome, Katinka. Thank you so much for being here. Dear Health, could you explain to us what kind of company that is? What do you do?
Well, Dear Health is a artificial intelligence-led care pathway solution. So what we deliver is a digital platform for the providers, so the healthcare providers, and a patient app for the patient. And what we actually do is processing the data that is in clinical practice. So most of it is in the electronic patient record, but other valuable data can be added to the data model once it's validated that it does have an impact on the disease-specific treatments. And we use the patient data that is uploaded from the patient's area environment themselves. So now we are living in the daily practice where patients upload their data themselves, but in the very near future, there will be sensors, there will be all full seamless digital tools that will generate the patient data without actually uploading data yourself.
Giving an example, I come in the room and they measure my temperature or something like that?
Something like that, or you look in the mirror and the mirror is taking the data and you only validate that the data is correct and can be uploaded in your patient app.
Okay.
So other solutions that I'm thinking of right now is a company that is developing a sensor for in the toilets where biomarkers out of your urine can be taken out and that can be uploaded. And of course,
no more pregnancy tests. Being in the toilet.
And those data experiences are actually what we are looking for. And so we are delivering a care pathway solution where we need collaboration with all kinds of partners, data partners, and we have a prerequisite for that they are delivering fair data, because then we know for sure the data is of the quality that we need. And what we actually generate with all the data from the patient and the evidence-based data that is linked to a specific disease is recommending a accurate care pathway. And that is decision support for the medical teams. Okay. So it's not a black box software that is telling you what is the best for you and you have to hope that that's the best for you. But we're generating a care pathway that is out there for the medical teams to accept or to reject or to adjust. Once it is accepted, the patient sees in the patient's app a 12-month care pathway with all the activities and all the advices in there, and is in control of their own treatment. And once something changes, for instance, pregnancy, of course that is of a huge impact once you have maybe not one disease, but maybe multiple disease, and pregnancy can have an impact on medicine, on specific tests that you need to do. So the trigger of the real world data combined with everything that is evidence-based and indication-specific is what we call our magic, and with our recommender, that is the function that is built in the software that does this, that based on your profile, on your personalized profile, you get a care pathway that is specifically there for you in your situation. Okay. And as we were founded in UCLA, the care system in LA in the US, and by Professor Medical Doctor Daniel Holmes and his team once he started in 2013. And as a spin-off, we started in 2019 our headquarters in Amsterdam and moved from a US-based solution to a European headquartered a young company where we strongly believe that both in US and in Europe, with all the stakeholders that we have in our network and that we collaborate already with, but we need to make that bigger and bigger and bigger to really being able to deliver at scale what we promise. And that is personalized healthcare, lower cost, and a more efficient healthcare for all of us. And most of every discussion that we have currently today are also about accessibility of health for more people. Yeah. And once we have this infrastructure, and we prove here in the Netherlands and in Europe that we can do this, we have not a product, not a service, but we do have like a full ecosystem with a best practice of what stakeholders exactly do you need to copy this around the globe. And of course, the good news is that if we do this good in the Netherlands, we do have a export product, or a stakeholder network as an export example that can be reusable across the globe. And that is where I strongly believe in the value track network that we are a part of, that in collaboration we really can have this impact that we all are looking for. And if you are part of open innovation and really open, then you make it happen. And in our collaborations with hospitals, pharma, health insurance, other startups that are popping up with all kinds of biomarkers that are validated if they do make sense in chronic disease management, it's like a fantastic environment to be in. And for us, regulations, of course, are our core basic thing to comply with. And as others in the discussions today, we really believe in the regulations as a facilitator, not as a blocking issue. Yes, sometimes it's complex, but if you get through it and you do it right, you prove for your own team, but also for all your partners in the stakeholder network, that you are of the level of quality that you can collaborate and that you all together can deliver at the quality level that is needed. Because it's about health, it's about people, it's about you cannot make any mistake because that will harm someone. And patient safety is on top of things. Everybody's mind every day. Every day.
Sounds very promising. And one question about the implementation of this system. You already said that it will bring down costs. So it's a big thing also, I think, for the society to invest in something like that. Will it be given to the people, the customers, through the hospital, through the healthcare, through the government, or should they purchase it themselves, or?
Well, as we started now, and everything is possible in the future, but we started really focused and making sure that we fit into all the rules that we have to comply with. So the patients are included, so onboarded by the medical teams. And medical teams are most of the time in hospitals, but also can be general practitioners or can be medical experts that are not specific in a hospital. So it's medical teams that onboard the patients, and once the patients provide their consent, and we do have a data processing agreement that we process the data, but we don't own the data. Okay. So this is also part of a vision where it's called the personal health train, where you have organizations that really make sure that the data is available and they own the data, where Dear Health is using all the data and processing it in a way that it's valuable for the patient care and for supporting the medical teams in making the right decisions at the right time.
Clear. Well, thank you very much. Do you have one last call to action? If you've seen the session today, is there something that you would like?
Yeah, well, it was a high energy session today, and I think the value track network proves that if you put people, virtual and physical, in an environment, that magic happens. And we discussed: is it just a coincidence, or is it because this is what we really need to do, and it's not a coincidence? But we now, as of today, have to take the next step altogether. And so my takeaway for today is, let's not start tomorrow, but really start today in taking the next step in the value track and start collaborating at scale.